hadn't come to the clinic, I wouldn't be sitting here today. I'd be dead.
Faced with breast cancer, no insurance, and no money to pay for treatment, Shirley Almond says Concord's community-free clinic saved her life, literally.
Went for my yearly mammogram, and it came back with showing that I needed to have another one done. And so I went and had that done, and they told me I needed to have a biopsy. And I had insurance from my husband passing away that I could lived on comfortably for quite a while, but needless to say, time I got through running from this doctor to that doctor to have these tests done, I was broke. And I just was not going to have anything done to see about it because I'm not the type of person that goes in debt for anything, so I just was going to put it off. And my daughter-in-law heard about this place, and she got me to come down here. And they helped me that night. They filled out papers. They got me back there. They got, my blood pressure was sky high. They got me on medication for that, like that night. You know, I didn't have to go home and wait and come back again to see if I qualified. They was here for me that night, and they didn't ask, you know, for anything.
That's the way the clinic does business for hundreds of patients each year. The volunteer staff of doctors, nurses, lab technicians, pharmacists, and office workers provide comfort, medical services, and prescription drugs to those who need it most. Harris County is medically uninsured.
We're here to help people who don't have insurance and don't have the financial means to pay for medical care and prescription medicines.
2 nights a week, Cabarrus County residents with nowhere else to turn come to the community-free clinic. Since it began in 1994, the clinic has steadily grown, moving 4 times to keep up with the demand. The staff provides a full range of screenings and treatments led by Medical Director Dr. Wayne Phillip. His job is to organize the medical staff and oversee treatment. His satisfaction comes from providing missionary medicine in his adopted hometown.
It feels good to take care of someone who comes in feeling ill, not sure how they're going to pay for their, for their health care.
Most patients suffer from high blood pressure, diabetes, and gastro reflux. Diagnosing those problems accurately takes time and effort. Much of that treatment requires expensive prescription medicine, something else patients need but can't afford. Longtime Cabarrus County pharmacist Bill Harris decided long ago he could fill that need himself. Annually, he and other volunteer pharmacists hand out thousands of prescriptions worth millions.
Being a pharmacist, it gives me a way to use my talents to help others. And so by doing that, like I said, I can come in and just help people by being here, answering their questions if they have them. And fortunately, we have the facilities here to provide the drugs for those people who would otherwise not get them, probably end up in the hospital and end up costing the community a lot more than something of this nature.
These folks that come in here have a lot of problems. They don't really know how, a lot of them don't know how to take care of themselves. And we kind of try to get them in a more useful mode of living. We try to get them in Medicare if they can, and we hope to qualify them through other services in our county to help tide them over until they can get on their feet.
We've taken a lot of those folks out of the emergency room so that they're able to take care of the things the emergency room should take care of.
It's really a great way to give something back to the community. This particular mission's medical, so to give something back in those lines, whether you've got medical background or whether you don't, to volunteer. There are all kinds of things that take place here.
It's such a positive experience to be here. I feel lucky to be able to contribute to this clinic. It does require a degree of dedication because of the enormous needs. Every week we have new patients with new problems to be solved, which keeps it interesting also. The personal rewards are great, and I love and enjoy being here. It makes me happy.
I don't feel neglected. I feel like they recognize me as a person. As health-wise, that's the only place that I can see that I need any help.
Anyone who's ever worked volunteer good time, they do it not just to
because it's the right thing to do, or because it makes them feel good at the end of the night. They do it because usually the people I'm working with there are fun. They have a good time because it's a good spirit endeavor.
I know I'm doing some good here, and that's a satisfied feeling. It's good.
Throughout its history, the clinic has made ends meet with a delicate balance of volunteers, donations, and fundraising. Each year, approximately 400 volunteers donate more than 5,000 hours to work at the clinic. Donations and fundraising are vital to making sure they have the tools they need to make their time worthwhile.
Well, we don't charge any fees for our services, so of course we have to do a lot of fundraising, a lot of grant writing, and we've been really fortunate. I don't know exactly how it happens, but somehow we always manage to get by. When there's a need, we are able to find the money.
And while patient service is the most obvious benefit of the clinic, there is a ripple effect from the clinic throughout the medical community.
And it helps take some of the burden off the emergency room. It also, because these patients, some are so ill that someone will see them, and from the physician's standpoint, they're not going to be able to pay them. They have to run practice. From the patient's standpoint, they're not going to be able to afford the medication, the tests involved. So I think both from a medical professional point of view, or even the patient, I think it helps both.
It was certainly a lifesaver for Shirley Almond.
They just saved my life. That's all I can say is they saved my life, because if they hadn't been here, I probably would have waited too long to find out, you know, what was going on. So they've just been a lifesaver for me.
To learn more how you can get involved with the Community Free Clinic, call 704-782-0650 or log on to www.communityfreeclinic.org.
Well, okay, great. Thank you for the opportunity to share the mission of the Community Free Clinic with you today. The clinic was established in 1994 by Dr. David Lockhart and Dr. George Lyles, and thanks to their leadership, vision, and hard work, we continue to make a positive difference in the lives of uninsured adults in our county today. My name is Venetia Scain, and I've been the director for the past 9 years. The Community Free Clinic will celebrate 15 years of service in February, and since the doors opened, the clinic has helped almost 10,000 individuals with health care or pharmacy services. Each of those 10,000 people is different, and yet they're also the same. They all lack health insurance, and as well as the resources to pay for health care and medicines, and they all need health care services in order to work and take care of their families. Each patient is also different with unique needs and stories, like Shirley in the video. I just have 2 other quick stories to share with you to give you an idea of the types of patients we serve. Cindy lost her manufacturing job and decided to retrain for a career in cosmetology. She has a seizure disorder, though, and needed medicine so that she could attend school. We were able to provide her that seizure medicine for free, and she's now retrained, has a new career, and no longer needs our services. Sharon, has been a patient in our night clinic since 2001. She's a home health aide, helping the elderly and disabled stay in their homes. She has high blood pressure and she's borderline diabetic, but the physicians that volunteer and the pharmacists in our night clinic help her provide the health care and pharmacy services she needs so she can stay healthy and work and help other people. The Community Free Clinic depends on volunteers in order to provide our services, and since our doors opened, hundreds of volunteers have come through to help. Each of those volunteers is unique, and yet they're also the same. They want to help by sharing their time and talent to make a difference. We have volunteers from age 16 to 80-something. Some are medical professionals and others are not, but they all come together to provide a solution to a very difficult community problem. There are lots of gaps in our nation's healthcare system that poor adults can fall through. Our free clinic is one of many across the state and across the nation that tries to fill some of those gaps. We do that with the financial support of people like you who want to help. We also fill the gap with volunteer support of medical professionals and others. At the Community Free Clinic, we recognize that everyone is different, but we also try to treat them the same by providing them health care with respect and dignity. Thank you for your commitment in past years to our patients and volunteers, and I hope you will consider supporting us again in your campaign this year. Thanks.
Thank you.